So pressure bag, Mark, in kids, we would think about doing push-pull, but that's labor intensive. If I'm in the back of the aircraft with my partner, that's going to tie me up completely. Both hands just
Right.
trying to get fluid into that patient.
Exactly. So that seems like an active technique, right? Where we get a syringe, a stopcock. This is what we've done in pediatrics and pediatric emergency care for years.
Right.
Pull the fluid up, turn the stopcock, administer it to the patient. So let's say an adolescent with toxic shock syndrome and a blood pressure of 70 needs probably a liter. And that's going to be 100 turns of that syringe.
That's
if
my
it's a 10
entire
mil.
flight.
Right. Can't do it. What are the other drawbacks of that? One is just figuring out how to set it up. Can I even find a stopcock? Do I remember which direction to turn it? Number two, did you realize that every time we use a disposable syringe for more than one actuation, we actually risk contaminating the line of that patient? Every germ in the environment can actually be introduced into the patient's IV through that plunger. And if you're doing it 100 times, you increase that risk dramatically.
That's a great point. I mean, whatever's on your gloves is on your gloves.
Exactly.
You're just going to keep going.
So that may be the best answer if that's all you have. And it's something we've used for years. A lot of military providers will use that very technique to administer blood in the field through an IO for a dying patient, pulling the blood up in a syringe, turning the stopcock, and pushing it to the patient. But it's still not optimal. There are drawbacks to it, although it's more active than the other things you described.
So now that really has my wheels turning. I mean, even that seems slow and inefficient. If we're talking about a minute or two making a difference, 10 to 15 minutes to do that's no better than a pressure bag.